Okay, live here. I am doing a conversation today with my dear friend and colleague Oksana Zhabiyuk, and we're going to be talking about ketamine assisted psychotherapy. So, really excited about that. Let me just, so I'm waiting for Oksana to join. Okay. Okay, just gonna add her here. Okay, invited her.
Hello, I'm
Okay,
happy to be
here we go.
here. Thank you.
Yay! Woohoo! So excited. So always so juicy to talk to you. So
Yeah, so nice to see you here. I will turn on my microphone. But
okay, yeah.
yeah,
Can you hear me? Okay, I'm
yes,
on
I
my
hear you good.
headphones. Okay,
What about you? Do you hear me? Yes, yes.
so we're
Okay.
gonna
Mm-hmm.
yeah, yeah. So I was just sharing that we're gonna talk about
Mm-hmm.
ketamine assisted psychotherapy. It's just right now it's becoming popular. I know you've experienced it yourself, and it goes in a broader context of psychedelic assisted psychotherapy, but we're just gonna focus on that
Yeah.
for now, so for today. So maybe we'll do another one about like broader other psychedelics. So let's dive in. Oh, no. Okay, I don't know if it's on my side or Oksana frozen for me. No. I don't know if something happens. So let's see.
Hello, this is
Okay.
just you're
I don't
not
know.
gonna what?
I was like,
Yeah, I
where
was
did
like,
you go?
what?
I lost you. Didn't even talk.
Yeah, yes, I'm so happy. Let's really
Oh,
talk. Yeah.
let's do it. Okay. So,
So
yeah.
I'm
So
I will be
Oksana's gonna interview
so
me
happy to interview
about
you.
this,
I
right?
have so many questions and I love psychedelics. I feel like psychedelics is our presence. If it's not even a future, it's already that something that we have, and it's something that is so pleasurable and
Mhm.
valued and we need it. Woo! And I love it. And I love that ketamine as a psychotherapy option. It's so open and everyone can use it. Actually, it could be
Mhm.
like a good
Mhm. Oh. Oh no, did I lose you again? What is happening?
This is so strange.
Okay.
What is
The
that?
universe is against us today.
Yes. So I just
Oh,
wanna just
okay.
mention that I'm so grateful that we have and psychedelics as an option to go deeper and do not like sit and wait until like
Hmm.
all our protection system are ready for us to come on in, and but just really have an option where we can open it in a safe environment and just like reconnect with ourselves. And so I'm so excited, and I
Hmm.
want to ask you, what is the ketamine assisted
Yeah.
psychotherapy, KP? Yes. Yeah.
KAP, yeah. So it's basically just like regular psychotherapy. You know how you come for a session with a therapist and just bring something you don't work on. Maybe it's like a symptom like depression, anxiety, or um, um, what's the other one? PTSD, right? Some people have it, something like that, or just generally you want to improve your life or get some new insights into what's happening in your life, into your patterns. And so you do therapy,
Mm-hmm.
but with ketamine. So it's a similar format, like you come to a therapist, but you also take, ketamine in the full session. So that's just basically
So
what I'm saying. It's therapy with
basically,
ketamine,
the difference is
right?
that,
Added.
like, here we have a therapy without ketamine, and here we have a therapy with the ketamine. What is the difference?
Yes.
The
The
same
same
goal, the same
goals, the
request,
same
but
goals, the
what is the
same,
difference between
yeah.
them? And like, based on the like on what is the difference between those sessions? Is it any different?
Yeah, well, I think so, right? We experience, I know you and I experience both therapy without and with. It's just that things like ketamine, which is considered psychedelic in a sense that it alters your consciousness, it allows you to go deeper into yourself.
Mm-hmm.
Like you said, we all have defenses, right? And a lot of times in therapy, we bumping up against those defenses, right? We just can't, it's like all up here in our mind. We're talking, 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 but we're not actually resolving things. We're not moving deeper into ourselves and seeing things from different angle. So that's the difference. That my opinion is that psychedelics and ketamine in particular allows us to go deeper into ourselves beyond those
Mm-hmm.
defenses,
So
like you
basically, we
said.
have like those like protection mechanism of the defenses, and here we go. We don't have them, and we can take a look what is inside more. Sure.
Yeah. Yeah, and ketamine, I feel like it's also gives us sort of, it's a dissociative, right? It's actually used for anesthesia. So it's kind of you dissociate it a little bit, but sometimes it can be a good thing if you so identified with yourself or with your symptoms. Like, for example, you're so depressed and you just can't see the way
Mm-hmm.
out. You're so in it. So ketamine can like kind of takes you out a little bit of it, and you look at it from a different point of view, a different place, a different state of mind. And there's so many gifts in that because you
Mm-hmm.
can see so much
Mm-hmm.
more.
Mm-hmm. And what is about the length? Is it the same 1 hour therapy as usual, or it could be longer? How long it will take?
Oh, you mean like, ketamine is a short-term treatment, right? So it's not like usually the way, say, I do treatment, sometimes people can come for just one session of ketamine. So usually we always
Mm-hmm.
do a preparation session. Preparation is needed for someone who, for example, if somebody never experienced any altered state of consciousness and they're like scared or like, what is it gonna be
Mm-hmm.
like? I don't know. Maybe it's gonna be too, they have all this like fears, or it's important to like set an intention. So we do preparation session, and then we do main ketamine session, and then we do integration session. So that could be like usually there are two, maybe two or three preparations. So depending how well the person just feels prepared. So it's usually like a short-term treatment. It's not like usually therapy is like a
Mm-hmm, mm-hmm.
long-term treatment, like for I've been in
Yeah, yeah,
therapy
yeah,
for years and
yeah.
years and years, and yeah, and I work with clients also for like long term, but this is more like maybe you just want to look at this one thing. So that's also kind of fun that you're not committing for
Mm-hmm,
like a
mm-hmm.
long time
So,
and you just want to do this. So the minimum I would say is between like 2-3 preparation, main ketamine session, and 2-3 integration. That's kind of the minimum, and then you can add main ketamine session kind of as you
yeah.
go. Um, yeah. So for some conditions like depression, they say uh, they recommend 2 or 3 sessions. Sometimes it just depends, but it's between you and
Yeah,
basically the client
and
to figure out.
just
So very,
curious about like if I am like like the person and I have something inside of me that I really want to take a look, or maybe something to change, and maybe I am in some cycle that is continue and continue, and I just don't
hmm
know how to get rid of it, or just like start to feel something different, and I'm afraid of it. I'm so afraid.
hmm
I don't like any like psychedelics or
yeah.
something. I hear that it's like it could be a lot of fear, so I get stuck somewhere, and it could be like painful, and I don't like it. What could you say to those people who are really willing to do this, but are afraid of?
Mm. Well, I would say that it's not definitely not for everyone, and you kind of as a client have to connect to yourself and really see if it's something that's calling you, you know, because I wouldn't say like, oh, everybody have to do it or should do it. But if you have an interest and you think like you want to do it, but you're afraid, then it's good to well, talk to someone and build that connection with a therapist that you trust, and then with that trust, actually be
Mm.
courageous and kind of go into those fears. It is true that it could be more uncomfortable than regular therapy because it is
Mm-hmm.
more kind of intense. So I would say that if people are really afraid, then it's get connected to
Mm-hmm.
someone and look at that fear. And some fears can be addressed. Like for example, if somebody feels like, is it safe? Okay, now we know it's safe because there's a lot of research that confirms it's safe. A lot of people doing it. There's
Mm-hmm.
minimal to no side effects. You always talk to a psychiatrist before you do it, and so they take your full medical history, and so they look at like, okay, what are some conditions that may be,
Mm-hmm.
contraindicated? So you go through evaluation that helps you to feel safe, that it's safe for your body, and then you're
Mm-hmm.
in a
Mm-hmm.
safe container
So, as I understand, the first
with
thing
somebody you
is
trust.
important up here is the safety. Safety, someone who holds you a
Yes,
container and like really make their best job to keep this environment safe and container safe.
absolutely, absolutely, and that's why it's very important when you're selecting the practitioner you're going to do it with, like a therapist or well, we're talking about like in the context of therapy, that you feel safe with this person. Don't do it if this like you like, oh, I'm not sure, because it is quite intense process. So it's very much about connection to this person and how you feel with them, which is safe and there's trust, and um, checked if you have like the mind is scared, like, oh my God, like what if it's gonna be something bad for my body, then you educate yourself, right? You can read research or talk to a doctor and they will assure you that it's safe for you
Yeah,
in particular.
yes, I'm just curious about this. I know that the ketamine is being used a little bit in a different ways than you're talking about. You're talking about ketamine assisted therapy. Uh, what about like this IV
hmm
ketamine infusions? What is that? What is the difference?
Yeah. So you could go right now to a psychiatrist and ask for ketamine treatment, and you'll be prescribed like 6 to 8 weeks of just ketamine infusions. Basically, what happens is that you come in the office, lay down. I mean, from I don't do this work, so it's all based on what I kind of know as a consumer. And for 40 minutes, they give you IV with ketamine, just like a drip, and you lay down and you relax, but you don't really necessarily are guided to look inside yourself. It's basically like
Mhm.
receiving medication. And some people find it beneficial. And for me, I'm like, wow, what a waste of a altered state of consciousness, right? Because I'm like, well, you are in the state anyway, so might as well take a look, like, right? Like what's happening in your life. Because why not? It allows you to see things deeper. And so I'm all about using that time to do
Yeah,
some
yeah.
therapy
So
with it.
it's yeah, yeah. It's like to take any tablet, a pill from just pain relief, or just to take a look what is causing this pain. Yeah.
Hmm. Exactly, exactly. It's like relieving the symptom. So ketamine still does affect your brain, right? So it changes your brain, and it does, like they find it's very useful, for
Mm-hmm.
example, if somebody's suicidal and they give ketamine and just
Yeah.
medication helps. So and so it's, there are cases and where it's really beneficial, but then you're not actually going inside and looking at the
Yeah.
root cause. And and I'm all about kind of digging deep and finding the root cause and working with the root cause so the
Yeah.
symptoms just goes away. So you don't have to relieve your symptom every 3 months. So you feel better after this treatment, but then maybe in 3, 4 months you have to go back because the root cause
Yeah,
hasn't
yeah.
been
So basically,
addressed.
it's like if someone is feeling something that they need to change or transform, or they want some, or just pain or something, it's basically some navigation to a new level or quality of life that they can have. Yeah,
Yes, exactly. Right. And it can
yeah,
be
yeah.
useful for sure.
Yeah. Could you
Yeah.
tell me also all the who like if you would like describe the person who can come to this therapy, what the problems it could be helpful with? Could you describe this? Yeah, any conditions that it could
Mm-hmm.
be helpful?
Yeah. Mm-hmm. Yeah, so right now to receive ketamine assisted psychotherapy, you do need a diagnosis. So you need to have some kind of like symptom like depression or anxiety or
Mhm.
PTSD or OCD. You like I know it's like diagnosis make me young too. They're like, oh, boring. But yeah, but you kind of have to go through, you go talk to psychiatrist first, and then they give you, so it's something like that, some kind of symptom basically
Mhm.
that you want to treat. And you go to psychiatrist. The way I do it, I work with Journey Clinical. So it's an organization with like psychiatrists, and so you get signed up, get matched with either nurse practitioner or psychiatrist. They do full evaluation and then prescribe
Mhm.
ketamine. So yeah, I think it's the application is much broader than that because I think like anybody can benefit from this, right? So even if you like spiritual seeker or you want some spiritual experience or transpersonal experience, it can be really helpful. It's just the model right now is that it needs to be a diagnosis. But they do it even
Mhm.
with couples now, which is interesting. So you can do like, yeah, you can do like a couples session where
Wow,
both
I love
partners are
it.
on ketamine. So
Yeah, I really believe I am a
yeah,
believer. Oh, yeah. When couple comes
right.
together and they
Yeah.
experience something together and make them even more connected to each other and more topic to talk about,
Yeah.
at least.
Yeah, yeah. I haven't dived into ketamine with, couples therapy with ketamine. But
Yeah,
That's
that
interesting.
it is, yes. And so, what is the mechanism of KAP? Its mechanism. How does this work? Yeah.
Yeah, so um, kind of mentioned a little bit about, so that's the way I see it, because you can go and kind of search
Yeah.
online and there's so much research. So they kind of, talk about that,
Yeah, for
but
sure.
from how I see it, right? Right. So the way
And
I
I
see
want to
it is,
see,
yeah, go ahead.
and it's very important for me, like to really see how how do you see it? Because basically, we all
Mhm.
searching for the therapist who is like a little bit the same or something that we the same values that we have. Yeah. So it would be great to
Exactly.
know, yeah, what is value that you see and you know, and what is the mechanism that is working for you and for your client.
Right. Right, because that's you just remind me that it's like important to find your practitioner, right? Because everybody does it differently. Some people do it very like clinical, kind of medical approach. Some people have more kind of spiritual orientation, right? So it just when you're selecting a therapist to do it with, it's also good to kind of interview them and see
Hmm.
what the values, like you said, if your values are
Yeah.
aligned with their values and how so this is the right person. So the person who's holding the container is very important, right? That
Mm-hmm.
you
Yeah.
kind of align with them. Yeah, and the way I see it is that, we all kind of we all have like ego structure, right? Ego structure is what we who we think we
Yeah.
are. It's our identity. It's our depressions, anxieties, thoughts, feelings. And it's kind of like I see it kind of like an egg, and you in it, and you're so sometimes you're like so identified with it, and you're like so you just can't see outside of that,
Mm-hmm.
right? And you just very much like boom, it's very tunnel vision. And the way I see ketamine works, it kind of like either loosens
Mm-hmm.
the shell or even sometimes
Yeah.
like breaks it, and you suddenly like free from that ego structure, and you're like, oh, there's so much more here. I'm so much more than just this little
Mm-hmm.
person I thought. Some people experience, and I've certainly experienced more of a universal like expansion feeling, like, oh my God, there's so much freedom and joy and happiness here outside of my little box I put
Mm-hmm.
myself in. So that's the way that's I kind of see the mechanism of ketamine working through breaking that shell, or at least loosening the tightness of that identity that we think we are, of our egos.
Yeah. And
So
just interesting about
yeah.
this part, like if it's loosening, it means that I need more ketamine, like as often as I take it, I will be more open and more white here. Or it's like, how does this work? I mean, how can we like make it as a foundation or something? Yeah.
Yeah, I think it's my we might think that actually, yeah, maybe. But the thing is, we can't rely on something outside of ourselves. I think psychedelics or ketamine just they show us what's possible for us, even without those drugs or medicines. They kind of show us the way, or they show us the state that's possible, and then we still have to do the work
Mm-hmm.
to, to ground that and integrate it in our lives. Otherwise, we're always going to be dependent on something outside of
Yeah.
ourselves to get us there. So, so to me, ketamine was like so when I did it, and it like showed me like, look, you're not who you think you are. You're not this like, you're not your anxiety. I did it when I was like feeling really anxious, and I was just like, oh my God, and I couldn't get out of it. I just couldn't break through. I couldn't think my way out
Mm-hmm.
of it. I was in it. And then ketamine was like, oh, look, you're not this anxiety. You're so much more. And so you um, kind of hears the place, and I get connected to the place. But then I still needed to do the work to remind myself of that place every
Mm.
day after. So it's not magic
Ah, it
pill
will
and
be
it's not
great.
magic
Yeah.
solution. Yeah, it would be great.
It
Just
will,
way you go.
it will come soon.
Just
Yeah.
magic wand.
But it's fun. Yeah, it's fun
Yeah.
always to look inside and to be like a scientist for yourself, like really to create your own pill
Hmm.
every day, something new. And
Exactly.
yeah, it's very interesting for me. And yeah, you told me about the length of the treatment. So I mean, like the length of the treatment is interesting for
Hmm.
me. Like really, if it's a day, not only like a couple of sessions before or after, but what is like what does this look during the ketamine treatment? Like, is it like an hour or 2 hours?
Mm-hmm.
How long it will take? Just for me, like really. Hmm.
Hmm. Feel into it. Yeah, so the usually we schedule for a session, we schedule 3 hours. When we're done preparation and we're ready to do the main
Hmm.
session, it's 3 hours. And then, so usually, you come in, we talk for a little, just maybe get grounded, meditate a little, set the intention, and then you take the ketamine. Usually it's by
Hmm.
mouth, so it's 2 tablets, and you just swish it like
Yes.
I know there are other fun ways to do it, but that's how we do it in the office. And then you swish it, and then the ketamine starts working within like 10, 15 minutes. And then the main, um, it, usually it's like an hour, hour and a half is when it's you under kind of the ketamine and it's peaking. And that time people do it differently. Sometimes it's kind of hard to talk during that time, so it's very inward. So a lot of times that's the time, or at least 40 minutes, when people are just really going inside and doing the journey, and the therapist kind of holds space, and there's minimal interaction. And after the client, you coming back a little, you can start interacting and sharing your experience, and maybe looking um, at different parts of your life and getting new insights, and have more of a conversation and a processing. And then usually by 3 hours, you still feel it a little bit, so can't drive probably, but
Hmm.
then it's wearing off. So that's how the
Hmm.
main kind of session
So it's
looks
about
like.
like 3 to 4, like 3 sessions before, like about, and
About an hour, just a
regular,
regular
and
therapy session, like an hour.
then 3 to like 4 hours during the treatment. Yes. And after, what about after? Do I
Mm-hmm.
need like a
3 hours.
session after?
Yeah, definitely. So it's not like that you maybe like need it, it's recommended, because it's very
Hmm.
important to integrate the experience. Again, we want to take that state of mind, the openness, maybe new insights that you had, and we want to make it the new baseline. Basically, we want to really ground that
Yeah.
experience in your life. So we maybe there's new skill that you want to practice, or maybe some clients realize like, oh my God, I'm
Yes.
so like my body is so tense, like my I need to start taking care of my body more. And then we'll really talk about like, okay, what are the concrete and practical steps you can do to keep this new state of mind, state of body, your new normal, so you don't relapse into old patterns, old conditions. So that takes integration, and integration is like also researched and proven to be a very important part of treatment. So usually 2 or 3 sessions for
Mm-hmm. After,
integration
yeah. Yeah,
recommended.
nice. Yeah, nice.
After, yeah.
Okay.
Hmm. Yeah.
Um, I see some questions that I wanted to ask you, and I was thinking if
Hmm.
you already open it up or not. Does KP address root causes of mental health issues?
Hmm. Yeah, we kind of touched on this, that that's I see it again the way, say, I work, right? I really want to see the root cause. So I guess it's more of a, yeah,
Yeah,
I think it can, it has the potential. Whether or not clients go there, it's up to them. Again, we
yeah.
can't force everyone to talk to me about their mother. But it can. I think we have a better chance to access root causes with ketamine than with
Because
us.
it's open.
This
Yeah,
way.
it's more open
Yeah.
here. I hear you.
Well, yeah, it's ego, like when you said ego defenses, so you're like in
Yeah,
my
yeah,
shell analogy or egg analogy, the
yeah,
defenses is what keeping us stuck. Um, and we won't let go, we need help letting go with them because they're so the survival base. They're hanging out so
yeah,
tight, they're protecting us. They're not realizing we don't need protection anymore, but we just
yeah,
can't
yeah,
see that.
yeah. I hear you. Yes, yes. And how did so as a yeah, I want to mention that I had an experience of ketamine with you. This was my second
Hmm. Yeah.
second experience. It was a little different because the first one was as a
Hmm.
group of people, and the second one it was with you as a personal. And I would say that ketamine was very interesting for me to use. I really love psychedelics, but as a way to connect with myself even more. And the ketamine showed me how to, in a short term, not like 12 hour, because a lot of psychedelics like 12 hours.
Hmm.
And it's a lot, actually. It's a lot of
Yeah.
long,
It's
and
a
it's
long, yeah.
harder to like come back after if it's 12 hour, yes. So this one was much shorter, but still very, very deep. I would say that it was a little bit similar to like a bufo or something. If someone is experienced, like when you like really go up and far
Hmm.
away. But also, it was interesting for me to see how some of my system works in my life and how does this connect with me, and how does some part of me doesn't connect with me, or I don't understand it, or what kind of truth is really truth.
Mm.
For me,
Mm.
like if you have like very similar values with you, because for me like sitting with you with the psychedelics is a lot, and it's very safe space, and I would say that I really recommend it because it's very safe. It's very not not pressure up there, not like a pushing, but just really be where you are. And a lot of
Mm.
time like really want to control and just push everything and change right away. But to
Mm.
really to be truthful, it needs some time and to take a look what is really there. And I would say that because
Mhm.
some of the values that we have together is about truth. And for me, always take a look what is the
Mhm.
truth. What is
Yeah.
something that I'm like lying myself still.
Mm.
I love to do this, and
Mhm.
a lot of time, in my childhood, my parents teach me do not lie to other people, but they never teach me do not to lie to myself. So
Mhm.
basically, I was able
Yeah.
to learn how to lie to myself. So in that way, I will not lie to others. You know. So now it's
Mm.
harder for me to take a look
Yeah.
and really find the truth, what is there, and especially if I never
Mhm.
known it.
Yeah.
And I would say that
Yeah.
ketamine and the
Yeah.
psychedelic like really helped me to see it a little in a wider way, like wider way. It's not a pill, it's not something that's like, okay, I know
Mhm.
the truth and that's all. No, it's a little because truth is always
Yes.
complex.
Right.
Yeah, we have a lot of
Yeah.
different on top things, but it was helpful for me to really take a look and then try to learn how to live my life from it, at least personally.
Yeah, yeah, yeah. And I agree with you. It's psychedelics. I mean, that's definitely my personal value is truth. I just rather see the truth, and I lie to myself also. I think we all do in some ways. But psychedelics and ketamine also are showing us what's true inside, and it becomes undeniable. And so it becomes harder. We can still ignore it and look the other way,
Mm-hmm.
but it's like, oh, it's right there. So that's one of the big values where what's true, what's alive, what's real is enhanced by psychedelics, and what's not true, defensive, doesn't serve life is
Yeah,
also visible. So, and then the choice is ours. Which one we're
yeah.
gonna follow?
Yeah, and
Which one we're gonna
sometimes we need
choose?
it, and I think it's a good idea to have like a therapy before and after, because sometimes we lose it. We lose
Hmm.
this truth. Like I lose this truth. So I see it. Doesn't mean that I will remember it all the time. So all my mechanism and all
Yeah,
my life is based on this lie. So it's much easier for me just to
yeah,
go and continue. But it's harder now because in some part of me, already know the truth. But just like to put this truth to my
yeah.
life and change this, it's a huge work. Yeah, it's a huge work to do, and
It
it's
does.
impossible to do this in like 3 or 4 hours.
Yeah, no, it takes sometimes it takes a long time. Yeah, and even though the treatment is short term, the work is not, you know, because the I think it can give you a glimpse, and then you still the integration is for I'll say forever. I think for me it's somebody said like evolution and growth over lifetime. So that's also my lens. Like I
Mm.
never want to stop growing and evolving. And psychedelics and ketamine also helps with that. Just like, okay, what else?
Yeah.
What else is
Yeah,
possible? What else
yeah.
is here?
And it's a great way to grow in a spiritual and transpersonal life. Yeah. And I have one more question is
Hmm.
how does KP help with the spiritual transpersonal explorations?
Hmm. Yeah, well, again, the way I see it is that it gives us access to a place in us that's beyond ego, beyond person, beyond mind. Because a lot of us, we identify with our thoughts or feelings or emotions, and then we think that's who we are, and
Mm-hmm.
then we don't know who we really are. Well, ketamine for me was very transpersonal, very like expansive, and I was definitely feeling like I am this universal
Mm.
consciousness, and I was so big. I was just like everything is me, and I'm everything, and that's a very, I would say, spiritual experience. That also, so see how we weave in because it's ketamine assisted psychotherapy is used for therapy, which is more like a medical model, but definitely there's so much potential even for like
Mm-hmm.
spiritual and transpersonal
Yeah, just
seekers.
the way how to become yourself, who you are. Yeah.
Yeah, who you really are, not your thoughts, not your body, not your emotions, but who are you, right? Like who
Yeah.
are you beyond
It's
that?
just interesting for me. How did you decide to do this work to others? Yes. How did you like? What was your I don't know
Well,
something that told you, oh, you need to share this with someone. How did you come with this?
mm, well, it's definitely from personal experiences because I benefited so much from this that I was like, yeah, people need to know about this. And now, like I said, I've had like 10 years of therapy, but I wouldn't make as much progress. And I still think like weekly therapy is so important and crucial, you can't kind of avoid that. But this just like whole different level. And so because I benefited so much, then of course like you want to do what you believe or know works, right? Because you also a coach and you work with people as well, so you also probably want to do things with your clients that you know working because they work for you and you see for other
So it's
people.
like it's not nothing that you found in the books, just someone was doing it.
Right.
Okay, let's take a look how to do this ketamine. I will just check the instruction.
Yeah, which is really interesting because when I did my MDMA training, the MDMA is the next one to be legal next year, hopefully.
Yes.
That's the whole other topic. But there was this question, yeah, right? There was this question, can a person really be a psychedelic assisted therapist if they haven't experienced psychedelics themselves? And my answer was it's not like that they can't. It's as a client, I wouldn't choose a therapist who hadn't had their own experience. But that's just me, because when I was choosing a midwife to give birth with, I like me personally wouldn't choose a
Mhm,
midwife who
mhm.
hasn't birthed the baby herself. But it's just me. I know some people have different preferences, and some people maybe want to choose based on
Mhm.
training and research and books. But for me, it needs to be like
Yeah,
embodied lived
yeah.
experience.
Yeah, it's hard to believe in someone that he didn't experience it. Yeah, we like really want to share experience with each other,
Yeah,
and to know that that person already like know how to like
navigate, right? Like navigate the space,
to them,
this
yeah,
altered state
if
of
they know how to
consciousness.
navigate this
Yeah,
space to
yeah,
themselves, so in that way they can navigate this space for myself. No, it's like
right, right, right. For yourself and then for your clients, you
yeah,
can help them
yeah.
navigate.
Thank you,
Yeah.
thank you. I feel like much more clear about like a ketamine um, psychotherapy. I feel good. Thank you for
Good.
so much,
Well,
so much information, useful information. And yeah, could you
yeah.
tell people
Thank you
how to
so
sign up?
much.
How can they do this? Like register or come or just what- how?
Yeah, well, so if people are watching this and they have some more questions about it, or they want to sign up with me and do this work, like I said, I work with Journey Clinical, who handle the medical piece, and I do the therapy. Oh, and by the way, there's also 3 ways to do it now. You can do it with me in the office. You can do it
Mm.
online via Zoom. Yeah, but there needs to be somebody with you to kind of chaperone or be there physically in the building. But it's possible, and there's also a possibility right now to do
Mm.
self-guided sessions. So, then I only do preparation and integration, and the person does their 3-hour session themselves with somebody, like in the build with them. So that's for safety. You just need to have somebody, but sometimes it's not even like a therapy guided session. So that's kind of cool that there's all these options and you can do it from your home, or it's really,
Wow,
really accessible.
so many.
So
Mhm.
please, yeah, yeah. So please message me if you have more questions, or if you want to do this, you just send me a DM and
Yes,
we'll set it
beautiful.
up.
Thank you, thank you. Yes, love it.
Awesome. Well, thank you so much. This was amazing. Like I said, I did it, tried doing it by myself, and then I was like, no, I need Oksana to talk to me because
I'm
it's gonna be much
so
more
happy and
alive
honored to
when
talk
we
with
talk.
you
So
and know about it even more. Love it.
yeah,
Thank you.
yeah, amazing. Thank you so
Thank
much.
you. beautiful day.
All right.
Bye bye.
Bye.